What's up, you guys? It's Crab with Clem here, and I've been an OR nurse for almost a year and a half now. And today, I want to discuss and talk about why you should consider taking OR as your nursing specialty. So, OR is a very specialized nursing area which is very different from your traditional bedside nursing. What do I mean by this? Ibang-iba siya sa bedside nursing, especially in handling patient ratio, in skills and techniques you need to master, and other things like that. So, today, I want to dive in on why you should choose or consider taking OR nursing as your nursing specialty. So, I want to discuss the pros and cons. So, sa pros muna tayo, then I'll discuss the cons and I'll discuss the very pro na I consider na which might change your mind or consider nyo rin when choosing OR as your nursing specialty. So, sa pros muna tayo. It is a very structured and predictable environment. What do I mean by this? It is very structured in a way that once you master the certain skills that you need on the job, it becomes a very routine and predictable working environment. Anong skills yung mga tinutukoy ko? First one is scrubbing, donning, gowning, drapings, and sterility techniques. Once you master the basic and you memorize your instruments, it becomes a very routine and predictable working environment. The next pro here for me is the one-to-one patient ratio. Bakit ko nasabing pro to? Because it is a very patient-centered na approach sa nursing. Unlike pag nasa bedside ka, most of the time you handle 8 to 10 patients if you're in the private hospital, and if you're in the public hospitals, usually 10 to 40 patients ang hawak mo per shift. Unlike pag nasa OR ka, most of the time ang handle mo lang is one patient at a time. For example, you've gone through a surgery, one patient at a time yon. Then after the surgery, there is the post-op, which requires you to attend to the needs of a single patient at a time. You will be the one na responsible for the recovery of the patient post-op, and you will be the one in charge on updating the anesthesiologist, the surgeon, and the main AP of the patient. So, that is one of the pros of being an OR nurse. And the second one is being the recovery nurse, which is I've talked about before na kung saan ikaw rin mag-handle ng recovery ng patient post-op. I consider that as a pro kasi 1:1 patient ratio kayo. So, after that, I want to discuss naman yung mga cons ng pagiging OR nurse. So, the first one for me is it is a very limited patient interaction. What do I mean by this? As I said before, one-on-one patient interaction kayo. I-handle mo lang yung patient for a few hours, then i-discharge mo na siya kung ambulatory or day surgery siya, or ita-transfer mo na siya sa ward or sa ICU, depende sa case ng patient. So, ang con dito is limited patient interaction. The second con in OR nursing, it is a very physical demanding job. Bakit ko nasabing very physical demanding job siya? The first one is the very long-standing routines when it comes to surgery. May mga surgeries na umaabot kayo ng 3 hours minimum up to 12 hours, depende sa case. Most of the time, ortho cases takes up to 3 hours minimum, lalo na pag hip replacement, ORIF, and all that. Most of the time, aabutin ka ng 3 to 5 hours sa isang case pa lang yun. Kaya, number one dyan is the long-standing duration of the surgeries. Lalo na pag neuro, which is aabot ka ng 12 hours, madalas 6 to 12 hours, and same rin with cardio cases. The next one is under physically demanding pa rin siya. Heavy lifting. What do I mean by this? You will be the one lifting the patients, transferring or positioning the patients during the surgery and during recovery. Pag transfer mo sa room, magbubuhat ka ulit ng patients. Lalo na pag wala kang kasamang NA. And the next one is the cold environment in the operating room. The cold environment preserves the sterility of the room kasi lower temperature means lower viral or bacterial growth rate. And syempre, maghapon or long hour standing ka, the aircon is always on para hindi kayo mainitan and preserve the sterility of the environment. The next one is it is a very high stressed environment. Why? Because it needs perfection. Bawal ka magkamali or limit your mistakes as much as possible kasi a small mistakes can lead to the deterioration of your patient's health. Lalo na pag bleeder yung pasyente mo. Kaya dapat mabilis ka, good judgment, and needs perfection. Kaya it is a very specialized area. The next con here is it is a very surgeon-centric culture. What do I mean by this? There are some surgeons who practice hierarchy when it comes to surgery. Anong ibig kong sabihin dito? May mga surgeons na may habit or certain preferences when it comes to their surgeries. May mga maaarte sa sterility, may choosy sa mga gamit na gagamitin nila, and may mga instances na may mga surgeons kang ma-encounter na nagmumura or nambabato or who will belittle you because you are just a nurse. So, isa yon sa mga pinakamalaking cons when it comes to being an OR nurse. It is a very surgeon-centric culture. Pero, not all surgeons are like that. I have many surgeons and doctors who are sobrang bait, interactive, tuturuan ka kung may gusto kong malaman or kung may hindi ka alam. Sila na yung mag-initiate na magturo sa'yo. There are some certain specialties lang talaga ng surgery na strict or may certain preferences ang mga surgeon. Some of that specialty is the ortho, cardio, and neuro. Kasi you must maintain high sterility sa mga ganong cases to prevent infection sa patient mo. Kaya it is understandable na minsan masungit ang mga surgeons sa ganong fields. The next one is on-call culture. Anong ibig kong sabihin dito? If you are an OR nurse, madalas or prone ka sa on-call kasi may mga surgeries na unexpectedly, whether it is umuulan, bumabagyo, or madaling araw na yan, you are on call kasi may mga surgeries na biglaan or emergency surgeries na kailangan or lalo na pag understaff kayo and there is a need for an extra person and ikaw yung nakatoka sa on-call sa schedule nyo. That is one of the cons for me. The last one is risk of losing your non-surgical skills. What do I mean by this? Kasi nakafocus ka lang, may mga certain skills ka na hindi na-practice such as IV insertion, NGT insertion, folicut insertion, and other things like that. Wound care monitoring and other things like that. Because once na dinala yung pasyente sa'yo, may IV line na sila, may central line na sila, meron na rin silang NGT or folicut na naka-insert, and things like that. So, most probably, you will lose some of your non-surgical skills, which is a con for everyone. Lalo na kung you're looking to transfer to bedside nursing, mahihirapan ka mag-transition from OR to other department. That is one of the cons of being an OR nurse. Sa sobrang specialized ng area mo, mahihirapan ka nang mag-transfer sa other department or mahihirapan kang mag-adjust sa other department kasi iba yung learning curve mo, especially kung nag-direct OR ka na without prior experience from other department such as ward, ICU, or ER. Those areas are more flexible when it comes to learning curve. Unlike pag nasa OR ka, limited lang yung skills na matututunan mo or napapractice mo, which leads to you losing your non-surgical skills. Then ayun lang yung I think na cons of being an OR nurse. So I want to discuss naman yung pinaka reason on why you should choose OR as your nursing specialty. That is, it is a very specialized focused environment na kung saan there are high career advancement and high demand in not just in the Philippines but in other countries. Kasi it requires time to train nurses to be able to be specialized in OR or ORDR surgeries. Kaya high in demand na kung kahit saan ka pumunta is high in demand ka dahil sa skills na na-acquired mo being an OR nurse. So, I think that's all the pros and cons for me of being an OR nurse. Those are the things that you should consider if you're looking for or wanting to be an OR nurse. Consider mo lahat ng mga sinabi ko. And if you learned something, I hope you like and subscribe and comment if you also think na same tayo ng views regarding sa pagiging OR nurse or regarding sa mga point of view ko sa other department. So ayun muna with Scrubbing with Clem. Bye.